All right. So we are again, as I was saying, we are very fortunate that we have Dr. Jason Ryan, the cardiologist, a mentor, a teacher, and most importantly, founder of Boards and Beyonds, something that started, I would say now many years ago, and it has become a source that every student is using. In the past 3, 4 years, I have had pleasure of teaching both MDDO students, and I did not find anyone who was not using either the text, the videos, the questions, or Board and Beyond. Uh, we have a few people from my med school Sims who would be helping us in moderating the session. One of them is Dr. Asan Khalid, other one is Dr. Ishal Fatma. Dr. Mariam Malik and Dr. Irtaza Ahmed will be joining us. So without further ado, Dr. Ryan, I would just request you to tell us a little bit about journey, and then many people have signed us so many questions, then we'll definitely start asking you questions.
Sure. Thank you for that introduction. It's nice to be here. I think many of you probably know my voice from the Boards and Beyond videos, and I'm grateful that so many of you listen to these videos and so many of you have found them helpful. For those of you who may not know, I live in Connecticut in the United States. I'm a cardiologist by training. Um, and in 2014, I was working at the University of Connecticut School of Medicine here in the United States. I was seeing patients in the hospital and in clinic, but I also had a role teaching first and second year med students. And it was in that role that I was given the idea by some of my students to start recording my lectures. Um, and so that is that's what led to the launching of Boards and Beyond. It was an idea given to me by students. I started recording the lectures that I used to give to them in the classroom. And over years, I built up many, many of these videos and added questions to the question bank so that you can test yourself after you watch the video. And I've been very fortunate to go on this journey. So many people like yourself from around the world, around the United States, have responded to the videos, have found them helpful, have spread the word for me. Actually, in the beginning, I didn't have any marketing or advertising, but the popularity of the videos grew from word of mouth. And so here we are now, many, many years later. The company grew beyond my wildest dreams. I sold it to McGraw-Hill, which is a medical textbook education company. I now work for them and consult with them to help expand Boards and Beyond around the world. It's been fantastic. I went to Dubai and met students at medical schools there who use Boards and Beyond. I went to Switzerland and met students there at a conference who use Boards and Beyond. It's just been amazing. So um, anyway, that's my story, and I'm here to listen to all of you, and I'm happy to answer any questions and give you any advice I can for preparing for step one or medicine in general.
Absolutely. No, that's a wonderful journey, and I think that you also mentioned that during our podcast that I think some of the students showed you the pathoma lectures, and then that also made you think at that time that maybe it's a good idea.
That's true. Yeah, one of my students, the way I first got the idea for Boards and Beyond was a student came to my clinic to shadow me, and I asked him how he studied, and he said that everyone at the University of Connecticut was using these videos called Pathoma, and he showed me the website. And those videos are Satar Hussein is an excellent teacher. The videos are excellent. And it was amazing that students in Connecticut were learning from a teacher in Chicago,
Yeah.
which is very far away. And that really gave me the idea that, at that point, the internet had reached a level where
Mhm.
anyone could really make videos and build a website. And so that really gave me the idea that maybe I should start making my own videos and see if I could get something to catch on, kind of like Pathoma. And so that was my inspiration.
Absolutely. And so I started I graduated in back in 2012, and then I started preparing. I could not prepare for USMLE exams during my med school because again in Pakistan, India, other countries that's not part of your med school system as it is here. So I started reading some of those books afterwards, and I was like pleasantly surprised because I think one of the biggest thing which I liked at that time was the clarity, because I was someone, and a lot of people like basic sciences, physiology, then the interaction, the interplay between basic sciences and the clinical sciences was, I found it difficult. And I think boards and beyond lectures was definitely something that made that transition easy for me. And I think I shared this sentiment with a lot of students over the years I have talked to. And I was, so one thing was that IMGs were definitely reading and the seeing your lectures and questions. But when I post residency, I started my job at Carillion Clinic. So I had the DO student from VCOM, the other MD students. So they were like, everyone was like, oh yeah, Jason Ryan, yeah, we see his lectures. So I was like, they are actually doing it more often than IMGs.
Yeah. Yeah. The videos are popular among IMGs, among US students. The reach of the internet, it's amazing this time we live in
Mhm.
when somebody like me can sit down at their office and record a 15-minute video and then instantly put it on a platform that lets people from Pakistan and Dubai and all over the United States see it if it's of value to them. It's a true
Absolutely.
meritocracy, right? There are
Mhm.
millions of videos out there
Yes.
just teaching the same topics I teach.
Mhm.
So, I need to do a good job and deliver a product that's valuable for people to want to spend their time on it. And luckily, that has worked out for me.
Absolutely. Dr. Ryan, I wanted to ask, the last time when we were talking, you and then I think later it was released, you told me that the relationship between your lectures and first aid, and how McGraw-Hill came out with a version of first aid, I think online, that they can actually click on the topic and then go directly to your lecture. Can you please tell us a little bit about that? I think that is very high yield for students.
Absolutely. So when I was in medical school, I used first aid for the boards to prepare for step one, and I really loved that book. Um, you couldn't really learn from it because it was just a collection of things you should know. But I loved that I had something to tell me what's important because for any topic in medicine, take cardiology, there are volumes that have been written about it. And how do you
Mhm.
know which pieces of information are important for the step one exam? And sometimes I had teachers who made it clear what was important for the end, but other times I didn't. I had teachers who sort of taught off the track and taught their specialized areas of interest. So I loved first aid, and I always wished more of my teachers would teach from it. So when I began to make the Boards and Beyond videos, I built them around first aid. I basically said, okay, I'm going to teach the students about renal failure. Well, what does first aid say is important about renal failure? And a lot of times it was surprising to me because at that point I'd already been in practice as an attending, and I'd say, wow, this is not something I think about much in practice, but it's heavily tested on the step one, this cell type and how it functions and where it's found. So I emphasized those elements from first aid in the videos. And this was a huge reason that it succeeded. I think people really felt like I could open up a section of first aid. If it didn't make sense to me, I could go watch Dr. Ryan's video at Boards and Beyond. And then when
Mhm.
I went back to first aid, now it made sense. Now I knew what all those different things were about. And so McGraw-Hill recognized this around the time that I sold the company. Um, they knew that they published first aid and they knew that my videos matched very well with first aid. So after they acquired the website, the Boards and Beyond website, they launched a digital version of first aid. It's called First Aid Forward. And it's now seamlessly linked with Boards and Beyond. So when you're watching a video on the Boards and Beyond website, right next to it is a button that you can click and you will see the exact page in first aid that corresponds to that video, and vice versa. If you subscribe to the digital first aid, when you open up a page there, you can click link and jump to the Boards and Beyond video. And from my point of view, I think this is fantastic. I mean, this is what I would have loved when I was a student, to be able to look at a page from first aid and then immediately get a lecture about that page. And then, of course, now that we've added a Q bank to Boards and Beyond, you can then go and do some practice questions from the topic you just learned. So This is a perfect way to build your foundation. That's really what your early studying for step one is about. You need a foundation. You need to just know what these different types of drugs are, know what these different liver diseases and heart diseases are, and how are you going to build that foundation? Back when I was in school, the only way you could really do it was reading a textbook, which is very difficult to do. And that's why USMLE scores used to be much lower than they are now. But now that you can do something like First Aid Forward with Boards and Beyond and practice questions, I mean, after you go through that exercise of looking at first aid, watching the video, and doing the practice questions, you will have a foundation for any topic that way. It may not be complete. There may be more you need to know. You need some more practice questions, but you will definitely be well versed in the subject to the point that you can then, press your studying into other areas.
Okay, so some people sent us questions, and then there is one question here. Miriam Naim is asking, Dr. Ryan, do you think first aid paired with, of course, Board and Beyond you just mentioned, and they're also talking about Enki and UWorld. Dr. Ryan, do you have any experience with Enki? I think these are the flashcards. And then, of course, UWorld, what's your response to combining those resources?
That's a great question. So McGraw-Hill recently partnered with Anki,
Oh,
and there is now a dedicated Anki deck that you can subscribe to through the Anki Hub. I think it's a few dollars a month. And you will get Anki cards that go with the Boards and Beyond videos that you just watched. And
wonderful.
because of this agreement, they've licensed our content so they can legally share images from the videos and things like that. And so if you add in the Anki cards to watching the videos, reading the first aid pages, and doing the questions, your foundation is going to be even stronger. And then you asked about UWorld. I mean, UWorld is an outstanding Q bank. I have so much respect for UWorld. It's really excellent. I wish I had something like that when I was a med student. I would have gone through those questions, dozens of times before the exam. I think UWorld is a great thing to do, but you can't do UWorld without a foundation. I mean, that's the problem. If you jump
Exactly.
right into UWorld and they ask you a question about, serotonin syndrome, and you don't know what serotonin syndrome is, you've never really heard of it, you're not going to learn much from that question. You're going to basically waste the question. You might learn a few things, you'll get it wrong, you'll read the answer, but it's not the same as doing that question. And oh, I've already watched Dr. Ryan's video on serotonin syndrome, and I did the Anki cards and I did the practice questions, and I have a foundation. Now that UWorld question, which is a very good question, and it really reflects the type of thing you'll be asked on the boards. Now you're going to really maximize what you get from it because you walked into it already with a foundation. And so that's how I think using Q banks like UWorld or Amboss and MBMEs are best used. You want to walk into them with a solid foundation that you've built up before you got there.
Dr. Abbas, Mariam Abbas has a question. Dr. Mariam Abbas, please go ahead and ask the question.
Hello, Dr. Jason Ryan. Can you listen to me?
Yes, I can hear you. Hi, Miriam.
Hi. I hope you are doing well, and I am honored to have you here. Like, you are a great mentor. So my question is this, like, how can we manage the burnout and keep ourselves motivated during long USMLE preparation period?
Yeah, that's a
Because
good
it's a
question.
very long preparation period and exhausted the preparation. So how can we manage the stress and burnout?
It's a really good question. So, in my opinion, the best way to manage that is to have a routine where every day while you're working hard during your preparation, you
Thank
are
you.
also doing things to keep yourself physically and mentally well. So, for example, when I was preparing for step one, I went to the gym every day. And now I used to go to the gym before step one, but it became a critical part of my day where I would go and I would not take any books and I would try as hard as I could to not think about studying and I would really get in a good workout. In medical school, I would play basketball with friends. Other people do other things. Other people read books. Other people watch movies. Other people go jogging, walking, hiking. But you spend time with your family. But you need to build those times in. You can't go 12 hours a day for 6 months. You will burn out. So let yourself have time to take care of yourself. It's okay to take a day off, a weekend off, even a few days if you need it. You should listen to yourself. Some of the students I've mentored who have done outstanding on their boards exam routinely took weekends off or other time off. They didn't feel like they had to study every moment. So as much as you may feel like I will do better if I can do one more video of Boards and Beyond or 10 more UWorld questions, the reality is that's only true up to a point. And so recognize your limits, find what works for you, and definitely take care of yourself. I mean, it's not a sprint, it's like a marathon. So you have to do some work every day, and then you have to stop, and you have to let your mind relax. And then the next day you have to do some work, and then you have to stop, and you have to let your mind relax. Taking care of yourself is really important. And this will have benefits beyond your STEP exams. When you become a trainee, the same things are going to happen. It's very busy. You can spend all day in the hospital. When you become an attending, you can constantly be working to get promotions and get papers published. For life, you will need to find the things that make you mentally and physically well and make sure you practice them all the time.
What a wonderful answer. So, Dr. Ryan, we got a question. So basically what Dr. Ishtiaq Ahmed is asking, that with your lectures and everything, we have some roadmap about step one, but step two gets a little bit blurry because I think he did not write, but what I'm inferring is that we have to score really high now because it's the only objective measure. So what would be again your input in regards to preparation about CK, how to maximize the score and how to do so efficiently?
Sure. So what's different about step two from step one is most students, when they're taking step one, have not had any clinical experience or have had very minimal clinical experience. So everyone taking step one has to build a foundation of knowledge from a website like Boards and Beyond or somewhere or textbook or what have you to learn about the topic. For step two, many students have had significant clinical experience. So you will have some foundation from that. And that is what should direct your studying. So for example, if you had an outstanding rotation in pediatrics with a great teacher, you saw lots of interesting cases, you took the shelf exam, and you feel very solid in pediatrics, then you don't really need a video website like Boards and Beyond. As much as I'd love to tell you to go and watch our Step 2 videos, I'll be honest with you that probably if you had that kind of experience, you don't need it. But then if you had a psychiatry rotation, for example, that was very disorganized and you didn't do very well on the shelf, you may benefit a lot from watching the Boards and Beyond Psychiatry Step 2 CK videos. So you have to be honest with yourself about which subjects on the Step 2 exam you feel you have a good foundation for. Once you have a foundation, the best way to prepare is questions. So UWorld, AMBOSS, MBMEs, and so this is why now that I work for McGraw-Hill and they're always thinking in terms of markets and where to sell products, the Step 2 market is different than the Step 1 market because the demand is not as high because some students have had very solid exposure to surgery or internal medicine or pediatrics or whatever. So in that situation, you can just jump right into questions. But remember what I said, if you jump right into questions about emergency medicine and you didn't have an emergency medicine rotation and you don't know a lot about it, you're not going to learn much from those questions, or you're not going to learn as much as you could if you go and spend a week or two and watch the Boards and Beyond Emergency Medicine Step 2 CK videos and then go and do those questions. So Step 2 CK preparation is much more focused on questions. But the mistake I do think some people make is not being honest about areas where they lack foundation. If you lack foundation, then you need to prepare for Step 2 like you did for Step 1 by watching videos and looking at a book like First Aid and doing Anki cards and things like that.
Absolutely. And I think, Dr. N, you make excellent point that if you jump, whether it's step one, step two, if you jump directly into the questions, there are no bases. You may get some right, but then there is no base. You have to be able to answer the question based on your knowledge and based off what you have learned, not because you just want to answer questions and you may get it right, but you don't have the strong foundation about it. Because some people also give some students have told me that they will get it wrong and then first aid, let's say, would give them explanation. What I tell them personally is to get an answer the question wrong and then read the explanation is significantly different than you actually knowing the basis and then able to at least attempt that question.
Agree. Yeah, no, I completely agree. You want to enter Q banks like UWorld and Amboss or MBMEs with a solid foundation, and that's the key. And you just have to be honest with yourself about where your foundation is strong and where it's not so strong. There are students, at least in the US, who have very good clinical rotations at their school, and when step two prep time comes, they feel pretty confident in most areas, and they're able to jump right into question banks. And I think that's okay, and I've known a lot of students for whom that works. I also know other students who jump right into question banks and end up regretting it because they're doing poorly, and they're especially doing poorly in certain sections where their clinical exposure was limited.
And doctor, and especially for IMGs, because our clinical rotations are, of course, different from how the system works here. So for them, I personally always recommend to at least read something, like at least read a textbook, see some lectures. And then I think you made an excellent point about introspection, that you should know what topics you are weak at, so that you can, let's say you mentioned psych, let's say biostats, you can watch some of those videos, read from like a shorter textbook, and then able to attempt the questions.
I agree entirely. Yeah.
And doctor, and some people have asked, and that's again a very common question, that overall ideal timeline, especially if you can tell us a little bit about IMGs, because of course IMGs, they may not necessarily have to do it during their med school, or they don't have that stipulation that if they pass step one, then they'll proceed because they have their own professional examination. So an ideal world, what would be a recommendation to make sure that one passes the exam? Ideal timeline for step one.
I think the two things so the closer you can take step one to when you learn the material, the better, because it will be fresh in your mind. So if you have an opportunity to take it shortly after you finish your med school classes covering all the organ systems, then that's a good idea. You also need enough time to prepare. So you have to balance that. If you finish all your med school classes, but you can't get more than a week or two of studying time, that's probably not enough time to prepare, and then you should wait. So I think it depends on your individual situation, but the key thing is to be honest with yourself about the foundation. If you are taking it right after you did med school classes, be honest, what subjects am I strong in? What subjects am I weak in? If you have to delay taking it for 6 months or a year or even many years, same rules apply. What subjects am I strong in? What subjects am I weak in? If it's been many years, you may need to restart over and go watch all the Boards and Beyond videos in different subjects to bring yourself back up to speed. And don't be afraid to do that. There's nothing wrong with that. Just because you had biochemistry 5 years ago doesn't mean you still know biochemistry. I've made videos on biochemistry and I forget it all the time when somebody asks me a detailed question, because it's not something I think about every day, or all these pathways and enzymes and vitamins. So if somebody said to me, Dr. Ryan, we're going to force you to take a step one biochemistry block tomorrow, I'd say you need to give me a few weeks to go watch some videos because I've forgotten all that.
Yeah.
So be honest with yourself about what you need foundation in and put in the time to get that.
Okay, and then doctor, and there's a question. So the question is, if someone has had completed their clinical rotation and during med school, and that's in Pakistan, while they are also starting USMLE journey, it is reasonable for them to try attempting a Q bank for step one and two simultaneously, or they should focus on like one step at a time.
This is just my opinion, and students are different. I've seen students do things that I think are crazy and they work. So nobody has a 100% correct answer for this. But in my opinion, the step one and step two exams test things differently. The step one is much more basic science, foundation, mechanisms. Step two is much more clinically oriented. What tests do you order? What drug do you give? So because they're so different, I think you should study for one at a time and get yourself in the mindset of thinking like step one. Because for example, you're going to be studying heart failure. And if you're studying for step one, you're going to need to know what the preload is, the afterload, the stroke volume. If you're studying for step two, you're going to need to know the names of the GDMT drugs and their side effects more, and when to order an echocardiogram. These are just different things. So you could try that, and I can see why someone would want to, but there is such a mindset to those two exams that are very different that, in my opinion, I would study for one at a time.
And then, Dr. Han, there's also a very common question that people sent us and they ask us that sometime, especially for IMG, since we don't have to take the USMLE during the med school, let's say someone just has finished 5 years of med school in Pakistan or India, and the fourth and fifth years are primarily clinical. So some people say that they feel more comfortable in taking USMLE Step 2 CK first because they had just like study from their big textbooks about medicine, surgery, OB, psych, and stuff like that. What's your opinion in that regard? That is that an appropriate way to do things? In your opinion, of course, people are different. Or even for CK, it's better to have a strong grasp of basic science before taking CK exam.
I think it's better to take step one before step two. I mean, because I think step one sets the stage for step two. First of all, there is some overlap of the type of thing. You still could get asked about preload on step two. You still could get asked about an echocardiogram ordering on step one. It's not impossible. So there's some overlap. And then I just think it's easier to learn that mechanistic way of step one, looking at the world, and then switch to looking at it clinically than to go the other way. So again, this is just my opinion and everybody is different. Another thing I'll tell you that you should remember is it's okay to switch your strategy. So if you say, I think I'm ready to take step two, and I think I have a foundation, I don't need any videos, and you start doing, let's say, AMBOSS or UWorld, and you're getting obliterated on certain blocks, it's okay to stop and say, okay, that didn't work. I need to go back and maybe take step one first, or maybe watch some videos first. I've counseled so many students who've done well who have changed their study strategy during the course of studying. So, in the beginning, you want to come up with what the best plan that you think makes sense for you, but don't be afraid to make adjustments along the way if you're finding that you're struggling. I've seen so many students do this. They say, you know what, I went back and rewatched your whole GI section, Dr. Ryan, because I just kept getting those stupid questions wrong. And I thought I knew it, but oh, that helped me so much. And what a great decision to do that rather than to just keep getting gastroenterology questions wrong in Q banks and MBMEs and trying to figure it out along the way.
And then, Dr. N, there's a question about the self-assessments. Of course, there are two of the more common ones, UWorld self-assessment and NBME.
Yeah.
In your personal opinion or your experience with teaching students, which ones are preferable and which one would you say have like more are high yield?
I don't know enough about the different ones to really tell you which ones are best or the others. I think you can take any of those that you choose. It's also always good. I always tell people this. It's always good to talk to people who went through what you're going through now last year. So I wouldn't ask if you're in Pakistan, I wouldn't ask a University of Connecticut medical student which are the most predictive self-assessment tests because you're come from totally different environments, totally different schools. So, find someone in your region of the globe from your medical school, find out what they used for self-assessments and which ones predicted, and I would go by that. Honestly, they're all probably about the same. If you're doing great on any self-assessment, you're probably in great shape. If you're doing horrible on any self-assessment, you're probably in bad shape. If you're in the middle, you're probably like everyone else. And no self-assessment is perfect. And you're going to have to make a decision on when you think you're ready to take the exam. But many students go into, I know we would all like to go into the exam getting 100% on every practice test we took the week before, but that never happens. And students who score off the charts often had poor tests going in. And unfortunately, there are some students who had great tests going in and then get disappointed by their score. So the reality is the test is different from anything you've seen before. It's not going to be the same. So you're never going to have something that says, here you go, 100% chance you're going to crush this test, go take it tomorrow. It's just not going to happen. So you're going to have confidence in yourself and recognize when you think you've reached a point that you're ready.
Then there's a question. So of course, that for step one, people would read from first aid, consider it like a very good, especially now that it's combination with your lectures, Anki. They're asking about CK because they're asking I think the question is there a similar book for CK that is as good as first aid for step one?
So I'm going to share you a link here of the first aid White Coat Companion. It's a book published by a former student of mine, Mike Lorinsky. I helped edit it. So take that with a grain of salt. But the reason we made this book is because we didn't think there was a book out there meeting the needs for step 2 that first aid meets for step 1. It's really gotten popular without a lot of marketing. This has really been a grassroots sort of thing, and I think it's definitely worth checking out. Unfortunately, the market has not found a perfect book for step 2 like it has with first aid for step 1. There are a lot of options out there. There's Master of the Boards, there's First Aid Step 2, there's White Coat Companion. All of them are okay. I mean, I don't think you're going to go wrong with any one of those. They're not going to teach you things that are incorrect or completely waste your time. But which one is best for you is going to be something you'll have to decide. And I'd recommend checking out the White Coat Companion because it's a new entry to the market, but it's gotten very good feedback from the students who've used it.
Okay. And then, Dr. Ryan, I think there's a similar question people have asked us that when you start preparing for an exam, let's say step 2, step 1, uh, how how far you are in your preparation when you should start uh, taking the practice exam, like NBME, self-assessment and stuff like that.
Yeah. Um, Again, no right answer. Everybody's different, but you should have a foundation. You don't want to go into the MBME and you really don't have a good foundation in hematology or genetics or something like that. So you need to have a good foundation, and most students do those after they've done some UWorld or AMBOSS or some other Q bank, and they're performing reasonably well. Maybe not, off the charts, but they're getting a decent enough score that they're not bombing the blocks they're doing, and then you can go and try some actual MBMEs. The reality is you want to expose yourself to lots of different question types. So, there's questions that go with the Boards and Beyond videos, there's UWorld questions, there's AMBOSS questions, there's NBME. I think it's good to try a bunch of these different resources so you see how different people approach question writing and things like that. So they're all helpful potentially.
And then there's a question, Dr. Ryan, that timed in the initial part of your preparation, what is more recommended, timed questions or untimed questions?
Yeah, I don't think you should do timed until close to your exam. When you're far out, you're really just trying to check your knowledge base and make sure it's secure. So there's really not a lot of value in forcing yourself to finish in a minute and a half. But I will say, when you get close to the exam, weeks away, a month or two away, you really should do some timed blocks because there are students who find the timing messes them up. They've gotten too used to being able to spend 5 minutes a question from untimed, and that's not good. So I recommend when your exams in the distant future, don't worry about time at all. You're just learning, you're just testing yourself. I wouldn't bother with it. But as you get closer, do some time blocks. Now, if you do some time blocks and you're having no trouble finishing in time, then you don't have to keep doing time blocks. I mean, it doesn't matter. But if you're doing time blocks and you find the time is tripping you up and you're not finishing, then you should keep doing timed blocks to try and get used to, marking the difficult questions that need more time, come back to those at the end, identify the ones you can quickly answer, get those out of the way, and, really strategize to maximize the time that you have.
Okay, all right. Uh, there was a question that there has been some issues, like there has been some invalidation of the scores, overall, the visa issues IMGs face. So sometimes it's difficult for IMGs, especially let's say from Pakistan, to keep themselves motivated. And I have seen your lectures, I have seen your videos. You always teach motivation and you always tell us the punchlines. So I would request you to share something because I know they were asking and I got a lot of questions too. There is some pessimism, there is some degree of hopelessness in overall IMGs, especially in regards to, of course, the new visa changes and all that.
Yeah. I mean, the only thing I'll tell you is most things in life that are really exciting and fun to do and satisfying, they're also hard. This is just the way life is. So, everyone has to make their own personal decision about how much they're willing to put in effort-wise. But, I will tell you that if it feels hard to prepare for step 1, other things you might want to do are going to feel hard too. I started a business. That was very hard to do. I know people who've written books. That's very hard to do. People who all sorts of jobs. If you want to rise to the top, be really good at it, get to do new and exciting things, it's going to require a lot of effort. So, don't be afraid to put in the effort. Don't shy away. And, it's okay to fail too in life. I was in med school with some people who dropped out and they have fantastic careers. And it's okay. It wasn't the right thing for them. So you don't have to know in the beginning that, definitely medicine is the perfect thing for me. But, I think don't shy away from the effort. I mean, so many things are hard. I've had so many things I've had to struggle with to get to where I am. And I think anyone who has any degree of success in life will tell you that it's always hard and it's normal for it to feel like it's hard.
Absolutely. Uh, there's a question. I think that again, with the question is about all the resources we have for step one. There is, I think, a new resource out in the market called Bootcamp. I think what they're saying is they have summarized all those videos. Dr. Ryan, have you had a chance to go through it or seen it or heard about it?
I've heard about boot camp. I haven't seen the videos. So I asked a couple students this. I don't know who narrates those videos. Does anyone know? Like, is it a doctor like me, or is it because like Scholar RX has videos from medical students
Mhm.
and residents, and I don't really recommend those. I think you're better off getting videos made by,
Mhm.
someone who's completed training and had some experience in teaching. And I don't know who makes the boot camp videos. Um, but anyway, the point is if I'm being honest, you can learn from a lot of these resources. As much as I would love to tell you, oh, you have to watch Boards and Beyond, otherwise you'll fail. I mean, that would not be right. Okay. Students have ignored Boards and Beyond and done well. Students have used Boards and Beyond and excelled too. So a lot of it is you and what you put into it. So I think it's okay to try any resource,
Mhm.
but if you don't like it, don't use it. No matter who tells you you have to use it, and be very weary of these Reddit forums that will tell you you have to do this or you have to do that. This, in my opinion, is nonsense. I have seen students study from textbooks alone and get great scores on step one and step two. I've seen students use only QBanks and no other resources. I've seen students use no QBanks and still excel. It all depends on you. So never let the internet convince you that you're making a mistake by using a resource that is working for you. So
Mhm.
if you watch a boot camp video and you say, I love this video, then watch boot camp. If it's helping you, you're learning how to take care of heart patients. My goal when I teach you guys in my videos, what I always want is I want you to understand how to help patients. I want you to finish your studying and your training and know how to help that person who has shock, how to help that person who has a stroke or a heart attack. If you're getting that from somewhere else, then to me, it doesn't matter as long as you're learning from it. So
Mhm.
all these resources are reasonable to check out. I can't really tell you, I can't rank them like one,
Of
two, three,
course.
four, five, and tell you, and honestly, even if I could, you shouldn't believe me because someone else would have a different ranking that's right for
Absolutely.
them. So you just have to make up your mind on your own, but never feel like you have to use certain
Mhm.
resources because you've read it on the internet or someone's told you.
Okay. And Dr. Ryan, there's always this question, even when I was preparing, that whenever you are doing question banks or even you are reading text or seeing videos, is it better to do like system wise? Let's say you are doing CVS, so do anatomy, physiology, biochemistry, all related to CVS, or better to go first do all anatomy, all biochemistry, all physiology, and that?
I think it's better to go organ systems wise, just because so many things relate to one another.
Mhm.
When you understand ischemia, then that makes it easier to understand heart failure. And then when you understand heart failure, that makes it easier to understand the drugs we use to treat heart failure. So I always liked studying by organ systems, and that's what I recommend. I'm sure there are people who do it differently, but um, in the end, when you're getting close to your exam, you want to shuffle it up. You don't want to just be doing heart failure all day and then endocrine all one day, because the exam is going to have you jump from one subject to another and back and
Mhm.
forth. So when you get close to the exam, mixing it up is fine. But when you're further out, I think it's okay to go system by system, just because each subject ties into the next one. There's a lot of overlap.
Okay. And there's a very good question someone asked that, and you also kind of touched it, that some people do really good on the practice exams and even in their med schools, A plus students, but in the exam, it's difficult for them to like stay focused, being able to do well and they end up having low scores, sometimes even failing. So, what would be your recommendation to stay focused during the exam and actually to pass it in flying colors?
I used to teach for a company called the Princeton Review before medical school. They offered these in-person courses to prepare you for the MCAT. And over the course of like 8 weeks, students would take like 6 or 7 simulated MCAT exams. Like they'd come in on a Saturday and they'd actually do blocks of practice questions just like the exam. And I used to watch students who were afraid they would not even be able to pass the MCAT, let alone get a good score, see their score shoot up by the end. So there's really no substitute for practice. So if you feel like you get nervous during the exam, simulate that environment. Sit down on a Saturday morning at 8 o'clock or whatever time it is when you're going to take the test, give yourself the exact same time and do a bunch of blocks. And you may need to do that 3 or 4 or 5 or even 10 times, but there's just no substitute for that. Putting yourself in that environment and getting used to feeling the experience. It is anxiety provoking. And you should also know if you get anxious during the test, like welcome to the club, right? This happens to everybody. So don't feel like you're the only one and everyone else is confident, but you're not. Everyone taking these exams is nervous during the test. They have some element of imposter syndrome where they feel like they've gone too far and they're not smart enough. That's all normal. It's okay to feel that way. Just keep going.
Absolutely. And then there's also a question that some questions, especially in CK, let's say they have long stems, whole scenario. What would be your recommendation to avoid getting caught up, distracted with all the irrelevant information and just staying focused on what they are trying to ask?
So I have a YouTube channel. I just shared the link in the
Yeah.
chat a minute ago. And I took the free 120 MBME questions, and for each one, I made a 5-minute video where I break it down for you. And if you're getting distracted by elements in the STEM, I strongly recommend watching those videos. The feedback I've gotten from students has been that it has been very helpful in teaching them how to approach problems,
That's wonderful.
because it is hard sometimes when you see this long STEM to recognize that it really all boils down to them just asking you, which ventricle is the problem in heart failure. Like, so, you know what I mean? And that's, most of these questions do boil down to one simple fact that they're asking you, but it can be hard to see that in all this language and all these words. So I strongly recommend watching those videos if you're having that problem of not being able to figure out what they're asking and getting distracted. And then, of course, you should read the last sentence first. This is so helpful. If you have a long stem, look at the last sentence, because it will tell you like, oh, they're looking for the name of an antibiotic, or they're looking for the name of a blood vessel. And then that as you read this long stem, and that makes it so much easier to triage the information. Say, oh, well, they want a name of an antibiotic. It doesn't matter that his maternal aunt had breast cancer 10 years ago. You can ignore that because you know what they're looking for.
Okay. And then also a lot of people have sent these questions that one or couple of weeks before the exam. Again, I know that everyone studies differently, they have different approach, but some things in your opinion that at least 1 or 2 weeks prior to exam that we should be really focusing on.
Yeah. So the crazy part about this exam is a huge percentage of what you study, 50%, maybe more, is just not going to come up on your test. It's just too big of a test for everything to come up. So you could go nuts the week before your exam memorizing the clinical criteria for lupus and not see a single lupus question on the test. You could go nuts going back over all those pulmonary physiology graphs and understanding dead space, and you won't get a single question about that on your exam. So because the exam is so broad, there's really not a point in killing yourself the week before with any one single topic. You want volume of topics the week before, okay? So, oh, I got a question wrong on dead space. Okay, let me remind myself what dead space is. Okay, then move on. Don't knock yourself out because you got that question wrong, because you may not even see a single question on it. Then move on and do some heme questions and some endocrine questions and some neurology questions, okay? You get the idea. I'm going to share with you guys an article I wrote here about how to prepare for step one. And it has a lot of these things in it that you should be aware of. A lot of the questions on the exam are experimental. They don't count towards your score. So when your friend comes and tells you, I got the most ridiculous question on Chagas disease, make sure you study that. Don't listen to them. That could have been an experimental question that had no bearing on their exam. And of course, they remember it because it was a crazy question that they're going to end up throwing out because it's so poorly written. So don't freak out about that. But again, what I would say when it gets close to the time of the exam is you want volume of material to go over. And then the other thing is, this is in my article, but fine details that you memorize, like the names of the RNA viruses, those will stick in your head a week before the test. They won't stick in your head a year before the test. So if your test is a year away, don't bother memorizing all the RNA viruses. You'll just forget it. Just learn the big picture, like what's the difference between an RNA and a DNA virus and why does it matter? But the week before, that's when, like a lot of students the week before review the blood vessels in the brainstem for the brainstem stroke syndrome, because it will stick. If I told you right now, the symptoms of a basilar artery stroke and your test is in 4 months, it won't help you. You'll forget it by then. But if your test is next Monday, oh, you might remember it. So these kind of like super nitty-gritty details, a lot of people make study sheets as they go and they review those the week before the exam, so those things stick in their head.
And Dr. Ryan, I think USMLE and other relevant parties are meeting, I think, in June or July to decide about the cutoff score for CK, I think, which is 214 right now. What do you think? Of course, you teach and you are very strongly involved in, not formally but informally. What do you think? Do you think they may go up, they increase it? Because I have never seen them reducing it.
No. Yeah, I don't really know what's going on, why they keep raising these minimum scores. Most students pass comfortably. So you don't want to. So if you think you're in a position where a cutoff movement of 1 or 2 points in the wrong direction is going to make you fail, then you need to prepare more for the test. That's not a good spot to be in. Okay, so ideally enter the test where your assessments and your practice blocks, you're scoring enough that you think you're going to pass by a comfortable margin. I don't know what they're going to do with the cutoff. I don't really understand why they keep playing with it.
Yeah, and I think the idea was so they have this meeting, I think, every year and then every few years. I think the idea was I think it started with really low 192, 198, 209, and was for some time, and now it's 214. So we'll see what they do. There's a question that when you are doing question banks, sometimes you get a really bad score in a block. How to regather yourself from like a mini setback that, oh, I really did bad.
Yeah, I just shared a link to an article I wrote on this topic. I mean, getting questions wrong is the best thing that can happen to you. It's like missing free throws in practice in basketball. Like you learn from it, and then in the game you don't let it happen. So you don't want to be getting all the questions right before the exam because that means the practice you're doing is not challenging enough to you. So when you get a lot of questions wrong, first of all, remind yourself that that's good. That means you've learned. You are now smarter than you were before you did all those questions because you're going to review them and figure out what you did wrong. The other thing is to remind yourself that this happens to everybody. I mean, I bombed so many blocks of, well, I didn't have a lot of practice questions like you did, but I had exams, I had quizzes. Everybody does poorly on these things. It is part of the process. It's normal. And really what determines your success is not whether or not you do poorly sometimes, it's how you respond to doing poorly. So remind yourself that this is normal. This is hard what you're trying to do. It's designed to be hard and you're going to fail sometimes. And that's okay. It's part of the process. And then just keep going. I mean, and there's stories abound about successful people who, failed here. They failed this. Successful politicians lost 9 elections and kept running. Famous authors got all their books rejected for years till one was picked up. I mean, there's so many stories like this. So just don't give up and keep going and know that you're normal if you have bad blocks of UWorld or MBMEs sometimes.
And then, Dr. Ryan, I have been stalling those questions because I wanted to touch these questions at the end. So there's a lot of questions about residency stuff, and I know that you have also been involved in that. You work at a place where people rotate and all that. So I think we can go over some of those. So I think a lot of people are asking about, let's say, if someone has an attempt, which is considered like a per se red flag. how can, as an IMG, they can improve their CV so that they can actually match despite of having like an attempt,
Yeah, you mean like an attempt at a
a
board
failed attempt
exam?
exams. Yeah.
Yeah. Um, it gets harder to match if you've had a failed attempt at one of the step exams. Unfortunately, that's true. I don't think those exams mean that you can't be a good doctor. I know lots of fantastic doctors who weren't great test takers. So just because you failed a step one or step two attempt or something, it doesn't mean you can't be a doctor, but it is going to make it harder for you to match. That's just the reality. Um, so the best thing I can tell you is you have to just be honest with yourself. And, if you've had a couple of failed attempts, this may not be the best path forward for you. It's just so competitive. There are just so many spots. But again, I mean, life is a marathon, not a sprint. People that don't get the first opportunity they want find a second opportunity that is sometimes even greater than the first. So, believe in yourself, have faith that life has more for you in store than just failing an exam and not getting a residency spot, and keep pushing on. It is very competitive to get into U.S. residencies as an IMG. Unfortunately, that's the case. The best thing I can tell you, people always ask me, well, I'm an IMG, how do I get into residency? The best thing I can tell you is to find other IMGs who are like you and find out what they did. Because it is different for someone from Pakistan versus someone from Dubai versus someone from Europe. All those paths are going to be different. So find someone else who's like you, find out what they did, and try to follow in their footsteps.
Mhm.
Observerships are very difficult to find. I get asked all the time for observerships. I don't know anyone who accepts observerships. The hospital where I used to work simply doesn't do it. It's a liability and a confidentiality thing, and they just don't allow outside observers to come in and float around for a while. So I don't have a great answer. The best piece of advice I've ever given IMGs who have come back later to thank me has just been find someone else just like you. Wherever you are, whatever school you went to, whatever scores you have, find someone who is like you, who succeeded, and then say, what did you do? That's going to be your best path forward, because someone like me who's in another country, who's not an IMG, is probably going to give you bad advice.
And Dr. And there's another thing which, let's say my personal question, a lot of people also, especially in IMGs, there's a trend, there's a generalization that a lot of people just want to do internal medicine. Like that's like their default choice. And then what they think or they wish is that by doing internal medicine, it's not very difficult to get into cardiology, gastroenterology, pulmonology, those comparative fellowships. You are a cardiologist yourself. Can you tell us a little bit about how competitive these fellowships are? And if, let's say, that their only aim is to get into US, do they really have to do IM? If because they feel that they are not doing IM, they will actually be cardiologists and gastroenterologists, especially in terms of IMGs, how competitive can be to get in some of these fellowships?
Yeah, those fellowships are competitive, but most of the programs you're going to met, like let's say you came, so the University of Connecticut takes quite a few IMGs every year. Um, and they can tell you each year how many of them got into cardiology fellowships and GI fellowships. So you will know at the program you match what your chances are. It varies by program. It helps if the IM program you're in has their own fellowship, because they often take internal people from within. Um, but one thing to know is once you get into internal medicine, you sort of get a clean slate, because the thing that's going to get you a fellowship is how you perform in residency. So maybe you barely got into internal medicine residency at the University of Connecticut. You were the last one on the rank list who got a slot. It doesn't matter. If you show up and you're one of the best interns in your class and you become a chief resident, you will get a good fellowship there. Okay. So you are no longer that person who slipped in and barely got in. You are now the star of your class. And all of you have an opportunity to rewrite your slate once you get into residency. So I wouldn't worry too much about fellowship. Just pick the field that you like and get into the residency.
And then, Dr. Ryan, a very common question, which I think I forgot to ask before, because I forgot it's also related to that, how to retain, because there are so many things like you were mentioning, RNA virus, DNA virus, biochemistry, pathways, and all that, Krebs cycle. Any advice like how to at least try to retain some of these things?
Yes. So I wrote an article about this too. I keep
Wow.
sharing these with you. It's
No,
funny
that's
because I get asked these questions
precious.
so much. Okay. But the key to retaining information is to study it at the right time. All right. I tell this story in this article about my echocardiography boards. They have a lot of equations on them about sound waves and harmonics. And a month or two after I took the board exam, I found one of my review books in my car, and I had circled an equation and started. But I could swear to you, I'd never seen that equation before in my life, although I had started and circled it. So obviously I'd seen it before. And my point is that information you don't use will slip from your brain in a few weeks or a month or so. So the fine detailed stuff you want to emphasize closer to the test. When you're further out, you just want to know, how does the heart work? How do the kidneys work? What are these different tumors like? What causes them? Big picture ideas, getting a sense of the foundation of the science behind it. Then when you're a week before your test, 2 weeks before your test, you can memorize the 9 different diagnostic criteria of scleroderma or cholangitis or whatever. It's key to try. You're never going to be able to just study the RNA viruses and remember them for the rest of your life. That's very unlikely to happen. I mean, you might, but if that works for that, something else you'll forget. If you're not surrounded by thinking of RNA viruses every day, you will forget them with the passage of time. I've taught these things, I've made videos on these things, I've taken all the tests, and I forget them constantly because I don't use these facts every day. So strategize your learning to how far away the test is. And that's what that article talks a lot about.
Okay. And Dr. N, I remember when I was preparing, there was a mnemonic kind of a book called Microbiology Made or Pathology Made Ridiculously Simple.
Yeah, I
Is
use this
there,
book too.
okay, so do you think that I personally felt that just associating those hard to remember things, hard to retain things with something like that, like I still remember that rhinovirus picture with a rhino. So,
Yeah.
what do you think about that?
So for microbiology, it's really a special subject in that there is so much detailed information and there aren't a lot of themes. Like if I remember a couple of themes of cardiac physiology, I can answer lots of questions from those basic principles.
Mhm.
There really aren't a lot of things like that in microbiology. It's just, why is this one gram negative and this one gram positive? It just is, and you just have to know it. And I think someone just posted this, but 𝗨𝗪𝗏 has really made their mark in
Okay,
this business
sketchy.
in micro. I hear mixed things about 𝗨𝗪𝗏 outside of micro, but I consistently hear that for micro it is great. And I think it's for the reasons you just said. Micro is unique in that it lends itself so nicely to little memory tricks, and if you can associate rhinovirus with a picture of a rhinoceros and somebody with a runny nose and whatever, and something that reminds you of what its cell wall looks like, that can actually pay off. That doesn't pay off so much in like pulmonary physiology. I don't
Yeah.
think, like you're not going to get very far learning dead space by a picture of a rhinoceros with a tombstone or something. It's not going to work. But I think it does work for micro very well. And I think 𝗨𝗪𝗏 kind of replaced, from what I understand, microbiology made ridiculously simple, which I used to also use all the time. And it was filled with little drawings and memory tricks to
Yeah,
help
yeah.
you remember the bugs.
Uh, so we'll be wrapping session up. Now I would open the floor for questions. If anyone has a question, direct question, for Dr. Ryan, you can raise your hand. I'll unmute you, and you can ask Dr. Ryan directly, and then we'll be wrapping it up. Uh, Please, and if you have been attending this, try not to repeat the question. Dr. Ryan has answered, I think, most of the similar questions. So if anyone has a question and they want to raise hand and ask, now would be the time. Otherwise, we will be wrapping up the session because there were some in the chat, which I think we have answered mostly. Meanwhile, Dr. Ryan, I will ask you a question. Okay, so it seems like a good question. Can you please guide us about the depth of the detail we should go in solving UWorld? So I think they're trying to ask the depth of the detail required or necessary to solve or understand those questions. It's a vague question, but that's what I got.
One thing I'll tell you about any question you're trying to practice on is that those questions are written by flawed human beings like me. So if you come across a UWorld question and it asks you for some super detailed piece of information that you've never been asked before, and you go and look it up on the internet or ask ChatGPT and it's very obscure, don't go crazy. Don't think that that means you're wrong and that something's wrong with you. That may be a bad question, especially if it's one of these questions that 40% of students are getting right or something like that. Some of these, what I do worry sometimes about is students see a year-old question, they get it wrong, it's super detailed, and they rearrange their whole studying to make sure they learn all these super details. Some of these questions are just bad questions. You're going to come across them on your actual exam. So, the level of detail, I would say, is whatever level of detail allows you to get a decent percentage of questions correct is what you need. But you don't need a level of detail that gets you every question correct because nobody's going to be able to do that.
Uh, Dr. Amna Shafat, you can unmute yourself and go ahead and ask question. You have your hand raised up.
All right. Thank you so much, Dr. Khan and Dr. Ryan, for this opportunity. I'm a big fan of both of you, and especially Dr. Ryan. All of you have watched you so many times, so this is like really refreshing to watch you in person now. So first of all, thank you so much for that. The question that I have is that most of us, because the currency is very different. So most of us have to sometimes work along with preparation. So there is like we graduate and we work for 2 to 3 years while we are taking steps. So we are working full time, managing steps and all that. So that somehow puts like a dent in our year of graduation. So how to tackle that or how to manage that so that while we're working in Pakistan, like 2 to 3 years after our graduation, before we match, how can we utilize that time while we're prepping for the steps? Thank you so much.
You're welcome. Thank you, Amna. I think if you had a good med school experience and it built a foundation, I don't think you need to really start studying till 6 to 9 months before you're going to take one of these step exams. So if you're not going to take it for 3 years, you're not going to derive a lot of benefit from studying for those first 2 years. It's just too far away from the exam. And I would just go and work and do medicine and do whatever your requirements are to get you to the point where you're able to take the step one exam or the step two exam. The benefit, the time where it's beneficial to study is when, you're about I think it takes about 6 months on average to prepare for these exams. Some people might do it in 3, some might do it in 9, but on average about 6. So if you have several years you're required to work before you can take step one exam, then I would just work until it's closer to the exam because studying years out is not something that's going to help much. You're just going to forget all that.
Dr. Ryan, as you mentioned AI yourself, a lot of people have been asking a lot of us about the role of AI now in step preparation or even question solving. What's your take on that?
Yeah, I mean, I'm impressed by AI. I think it's really amazing. I think it's a great way to dive deeper into subjects. So if you are getting questions wrong on biostats, you can ask AI to explain to you sensitivity and specificity in multiple different ways until you get it. And then you can say, please give me a couple of practice questions about this now to reinforce it. The questions won't be great. I've seen the questions they generate. They're not UWorld quality or NBME quality, but they're also not completely terrible. So they will help you to just sort of reinforce. So I think the use of AI in preparing for these tests is still evolving and nobody knows where it's going to go. But the most common thing I hear from students is that they use it to just dive deeper into subjects that are nagging at them. So I thought I know sensitivity and specificity, but I keep getting these questions wrong. Let me go to ChatGPT. Let me show it a question I got wrong. Let me ask it to explain it to me, and then let me ask it to give me 4 more questions along those lines to reinforce it. Now I can go back to whatever I was doing before.
So, Dr. Ryan, thanks a lot. We'll just conclude the session. I hope that one day or even sooner we can invite you, like you went to Dubai, invite you to Pakistan. We can invite you to SIMS or medical schools and arrange a lecture for you. That I think it would be a huge thing for all the medical students and USMLE aspirants that down the line we can arrange something like that. I would request you to please tell all of the students who are right now here, who will later watch this video, anything in terms of USMLE step preparation, residency preparation, any concluding message or your last message for the session.
Yeah, I guess I would just say that the journey you're all on as IMGs trying to pass these exams, and it's really a test of your faith in yourself. I mean, it's a really challenging journey. There will be a lot of naysayers along the way. And for some of you, it may be right to stop the journey. It's just not going to work out, and there are better uses of your time on this planet than this. But for many of you, I think it's a good use of your time, and just don't be discouraged. Believe in yourself. Lots of things in life are hard. Even if you don't do this one, if you try to do it in some other field, law, engineering, economics, you're going to find hard things just like this. So, I grew from preparing for the STEP exams and for going through medical training in my faith in myself because I doubted myself so many times along the way. And then I had to reset and convince myself I can do it. And, it was a real growth experience. And I think a lot of you can do it too. So don't give up too easily, and know that when it's hard, it's normal, but have faith in yourself and keep going.
Well, thanks a lot, Dr. Ryan. It was an absolute pleasure learning from you and having you here at our forum. And hopefully in the future, we can have you in person. Have a
I would
good
love
rest
that.
of your
Yeah.
day.
What university did you teach at in
S-
Pakistan, Ahmed?
So in Pakistan, we are from Services Institute of Medical Sciences. That's in Lahore. So it's not a very old one. It's like 15, 20-year old, but it's the short is called SIMS.
Hmm.
So SIMS Lahore.
Okay.
Yeah.
So the McGraw-Hill does have a sales group that covers the Middle East, and I will let them know because I've done a couple of podcasts with schools from Pakistan, and I'd love to come sometime.
Absolutely, absolutely. It would be an absolute honor. Thank you, and everyone, thanks for joining. Have a good rest of your days. Bye.
Thank you, everyone.